all of my private patients are offered Mako robotic arm assisted surgery for hip and knee replacement. The Mako robot is a relatively recent innovation in the United Kingdom, and we have the first Mako robot in Bath. The Mako robot uses tried and trusted implants and surgical approaches, but what's different to a manual old-fashioned hip or knee replacement is that before your surgery, you'll have a CT scan. That CT scan I will look at with the Mako company, and we will decide exactly where to put your hip or your knee replacement. The Mako, during your surgery, enables me to put it in exactly the place that we planned before your operation. Patients will ask me, why have a Mako replacement compared to a non-Mako replacement or a more traditional manual instrumented hip replacement? The answer is that the Mako allows me to put it in the perfect spot every time, giving me perfect looking post-operative x-rays. There's some evidence that it decreases blood loss, less pain after your surgery, and faster rehabilitation. I use the Mako robotic arm for knee replacements. It enables me to put the implant in the correct position every time. There's evidence that it decreases the amount of pain post-operatively, gives you a faster rehabilitation and less blood loss. All surgery carries risks, and the risk when you have a Mako hip or knee replacement is the same as if you have a manual old-fashioned hip or knee replacement. And those risks include things like bleeding, blood clots, infections, problems with the implant, and a problem with your general health after any major operation. And they can include things as serious as a heart attack, stroke, kidney damage or confusion, or a prolonged stay in hospital. After having a Mako hip or knee replacement, the average length of stay in hospital is 2 nights. After that, you'll be seen by our physios on a couple of occasions, and I'll tend to see you at about 6 weeks, where most of my patients are no longer using walking aids and are starting to come out of that pain. After a Mako total hip replacement at 6 weeks, most patients are relatively pain-free and mobilizing without any walking aids. The average age in the UK for a hip or knee replacement is 70. That is also the average of my patients. I will operate on patients younger and older, but we know statistically that if you are young and you have a hip or knee replacement, your chances of revision or needing a redo are higher because you have a high level of activity, and there's a chance of you wearing out that implant. If we use the Mako, we don't know if those numbers are any different, but because the implant goes in perfectly every time, I do hope that they will last longer.